Okay, Heather, so let's move on to the physical exam. So first of all, I want to ask about your sense of smell. Have you had any changes in your smell? Are you able to smell things?
Yes, I don't have a problem.
Okay. All right. I'm going to have you just quickly look at this card and tell me which line can you read?
I cannot read the smallest, but here you go.
Okay, and how about the other eye? If you switch eyes.
Oh, this is better. I can read everything.
Oh, wow, all the way to the bottom? Oh, good vision with that. Okay. So that's optic. First one was oculomotors. Optic nerve is number 2. And then, okay, cover one eye for me. All right. And so I'm going to test your visual fields, and so I want you to tell me when you can see my fingers wiggling. Yes? Okay. And I'll switch the other eye. You can help me do the test, aren't you? Bless your heart. And then we'll do a fundoscopic exam. So I'm going to have you look as far in the distance as you can. Red reflex. There we go. Moving in. I'm checking the optic disc, speech colors. I can see just the small quadrants. Sharp margin, no papillary, no anti-nicking. Switching to the other eye. Same thing. Keep looking straight ahead there for me. Nice red reflex. Nice peach colored disc with similar findings of the first. And that's optic nerve number 2. Moving to oculomotor. First we're going to just check pupil response. And so that's number 3. So just look straight ahead for me. Brown, reactive to light. And then we'll check consensual response as well. Okay. All right, good. And then I want to just check your visual fields a little bit more, so I'm going to look at oculomotor number 3, trochlear is number 4, and abducens is number 6 to get all the eye movements. The trochlear is medial and down, and abducens is lateral, and oculomotor is everything else. So follow my finger.
And do you have any children?
All right. Don't go off the board for 100. You follow. All right. That's good. Okay. And then we'll move to cranial nerve number 5, which is the trigeminal. It's got 3 divisions. The corneal reflex, which I'm not going to actually test her, but if she blinks, then she's good for that. And then to check the sensation, you can just hit forehead and close your eyes and tell me when you feel it. So she's got that, and then the final division is the motor part of it. So I'm going to actually feel, and can you clench and open it and feel in the TMJ. And does that cause any pain for you? No? Okay. So that's the cranial nerve number 5. And then we'll move on to cranial nerve number 7, which is the facial nerve. So I'm going to have you do a few things. Can you smile for me? Okay, good. And she's showing her teeth at the same time. Frown. Okay. All right. Raise your forehead. There you go. And pop out your cheeks. And then I'm going to have you close your eyes really tightly, and I'm going to try to go. And that's facial nerve, number 7. Number 8 is the acoustic nerve, or vestibulocochlear. It's got 2 divisions. One is for hearing and the other is for balance, so we'll test the hearing portion right now. So I'm going to have you occlude one ear, and I'm going to whisper, and you're going to tell me if you can hear me. So. Good. Now the other one. Perfect. So she's got good hearing, so I don't need to do any branching exams for that. number 9 and number 10, we'll check together. Those are glossopharyngeal and vagus nerve. But first I want to ask, have you noticed any differences in your sense of taste? Are you able to taste sweet and sour and salty and bitter? Yes, all of those. Okay. So I'm going to check in your mouth, and I will check her mouth at the same time and take a look at her throat and everything since I'm here looking. We're just going to do the full hail deal. Okay, so go ahead and say ah. Okay, good palatal rise. Maybe a little extra mucus back there, but the throat is nice and pink. It's not red. I don't see any exudate. I'm going to look under your tongue. Lift your tongue for me. Dentition is great. I don't see any problems with that. I don't see any ulcers, lesions. Nothing concerning in your mouth. All right, now you can stick your tongue out at me. And that's hypoglossal number 12. We have fun, if nothing else. All right, so now it's spinal accessory nerve, number 11. I'm going to have you raise up. That's the trapezius and the spinal accessory muscle. And then I'm going to have you turn against my hand, sternocleidomastoid and accessory muscle. Good. That is all your cranial nerve. Hallelujah. We're going to move on now. Checking for tenderness of sinuses, maxillary, and oh my gosh, frontal and maxillary. Yes, and then we'll check over your temporal arteries since we need to check that. And then I'm going to check certain nodes. So we'll try occipital, postauricular, preauricular, retropharyngeal, submandibular, submental, posterior cervical, and anterior cervical, supraclavicular, and infraclavicular. Checking all the nodes. I'm going to have you do some motions with your neck for me. And you perch down, and then put your head back as far as you can. Okay, good job. And then back to neutral, and turn to the side, and then bend, and bend. Any pain with that? Okay, good. You're doing great. Bless your pea picking heart. Okay, let's do sensory first. So I think if I understood her right, we didn't need to do yeah, where did I put my little okay, here we go. So I'm going to close your eyes, and then you can tell me when you feel it.
Yes. 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 Yes.
And then we can check lower extremities as well.
Yes.
Yes.
Yes. Yes. Yes. Yes. Yes.
Okay. And then flip your shoes off for me, hon. And I'm going to move your toe, and you tell me whether it's up or down.
Up. 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 Up.
Okay. So good position sense of her toes. And let's try a little muscle strength stuff. So let's start with your grip strength. Go ahead and squeeze. Nice strong grip bilaterally. Put your fingers out and resist. Okay, good strength there. I'll go like that and hold your thumb. I'm going to pull. Good job. Now make a fist, and you're going to push down. Okay, good job. And then biceps. And whoops, keep your hands like that. Triceps. Okay. And then let's try your lower extremities as well. We'll do one leg at a time because it's really hard otherwise to do. Push down. Okay. Down. And then out. And in. Pushing. Oh, come on. There you go. There you go. Okay. And then we'll try your quads and hamstring. Hamstring. And then push. Up. Up. And then I'm going to do just your big toe last. Okay, good. So she's got good strength all the way. And now let's check a few reflexes. All right, let's start with your biceps. Just keep your arm as loose as you can. Okay, that was good. All right. Get this one nice and loose. All right, good. Yeah, that was good. All right. And now we'll try your triceps. All right, not too bad. That's a hard one to get.
Yeah.
All right. Okay. And now we'll try to break your radialis. Keep your arm as smooth as you can.
Yeah.
A little bit. Good. And then we'll try your patellar. Good. Okay, and I'll wait to do the Babinski. I think it's easier when they're laying down than trying to get under and position their foot and everything. Okay, so let's have you walk. And go ahead and I'll just look at her gait. All right, great. Now toe walk on your toes. On your toes. Oh, that's lovely. And you can come back on your heels. So we'll do that. And then tandem walk last. Oh, that's lovely. All right, come back over here. Stand up still. I'm going to have you stand up a little bit more. So she's got really good balanced cerebellar. So I'm going to have her close her eyes and just make sure her proprioception is good. It is. I'm going to extend your arms out in front of you. Keep those eyes closed. We'll check for pronator drift. Bam! You're like the star patient. Okay, so she did fine with that. The other thing I think that I would do is do a little check of your check your carotid pulses. Nice.
I cannot.
Oh, okay. All right. Okay. This is for Ruiz. Pulses, not hearing anything. Okay? And then I will just take a quick listen to her heart. Flip it around. Okay, and then we'll listen to lungs. Just breathe in and out of your mouth. Then I'll go ahead all right, and then listen on your back. AP diameter is normal, and I'm also checking skin, both front and back, to make sure there's no rashes or lesions. She's pleasant, cooperative, not having any difficulty following directions, and that is my exam.